to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're talking about the emotional and physical reality of living with long COVID and sudden disability and how to advocate for yourself when everything changes overnight. We're honored to welcome Anita Widowson, a content creator, advocate, and former radio presenter whose life was dramatically altered after a COVID-19 infection back in 2022. Anita now uses her social media expertise to raise awareness for chronic illness and disability, bringing comfort, education, and support to a growing online community. Anita, thank you so much for being here today. How are you doing?
I'm good, thank you. Thank you for having me, Dr. Borrelli. I really appreciate it. I'm doing very well, thank you. How are you?
Of course. Great. Thank you for asking. We are so excited to talk about your story and learn more about what you're doing. So let's start with your story first.
Mhm.
You went from being fully mobile and academically thriving to suddenly living with limited mobility and brain fog. How did you begin to process that kind of change?
So, at first, to be honest with you, I didn't process it at all. I lived in a state of,
Sure.
say, 6 months of complete denial that I was going to wake up one day and it was all going to have gone away and everything would go back to normal and it would be like it had never happened. Um, and I suppose in some ways that is what kept me going for that first 6 months, because I try and look back now and I think, wow, I cannot believe that, I handled all of that. But it's because I think I hadn't fully accepted it yet.
Sure.
Now I say that I'm in a state of, I've sort of planned out two different life paths now, because my original path was I was going to continue down the academic route. I was going to become a lecturer. That was going to be my job.
Mhm.
And I've still left that path open because at the end of the day, long COVID is still something that is so new. There is still a chance that at some point there may be something that comes along that can ease my symptoms to a degree where that plan is possible. But I also now want to use my own experiences to help other people. And so that's my current path, is trying to find a way where I can create this into a job where I can live sustainably, but also be able to help other people in processing what they're going through. So I think that has really helped me deal with everything I've been through, is the fact that I can share my knowledge with others.
That is amazing. I think that is so great that you took that challenge and transformed it into something positive, not only for yourself, but for others.
Thank you.
And of course, you've spoken about the challenges of getting taken seriously by medical professionals, especially when you're dealing with invisible symptoms like brain fog and pain. I know a lot of my patients and clients deal with this as well. So, what advice do you have for others who feel unheard?
I think there's two pieces of advice that I would give here. So the first one is, like you said, you feel really unheard and it feels very unfair. And after going through that for so long, you do essentially develop this feeling of negativity when it comes to being seen by a doctor or by any kind of medical professional. You just instantly assume, I'm not going to be taken seriously. Why would I bother? And that's definitely something that I did for a while. And it was something I actually brought up in therapy. And it was my therapist who pointed out that 9 times out of 10, every time you see a medical professional, it's somebody different. And you need to start it with a clean slate. Just because your last experience with a doctor was awful, you need to remember this is a new person. Go in there fully armed with everything you need to tell them. And at some point, it might take longer than it should, but at some point, you will come across that doctor that actually listens to you. And the second piece of advice is, once you do find that doctor, make sure that you've had a system where you've made notes of the way that you've been treated in the past. Because if you do get diagnosed with something or you get treatment for something that in the past you've been brushed off for, this is an opportunity where you can make sure that this doesn't happen to other people, and you can complain about your treatment and make sure that the system changes, which is something that I'm going through at the moment.
That is so important. I love that you pointed that out because I know a lot of experiences occur where a patient goes to an appointment, they have a very poor outcome, whether they feel unheard or They were kind of dismissed. And then when they go to a next appointment, they kind of come in with all that anger from the previous
Yeah.
appointment, even though it's a completely different provider. And right from the start, that appointment is probably not going to be have the best outcome because they're coming in hot and upset and not really able to focus on.
And that's exactly what I used to do.
It's very understandable because I think as humans, we often try to prepare ourselves based on our last interaction or our last experience. So if we had a bad one where we felt attacked or dismissed, we're going to kind of walk in. Our first instinct is to walk into a new one where we're on guard and hoping to try to prevent that from reoccurring. But it's not the best tool. So I think that was such an important point that you brought up because it's definitely a great way to practice where you're kind of taking a step back, thinking about it, writing it down so you know what things were overlooked in, but you're going in with a fresh perspective and giving this visit and this provider a whole new opportunity to kind of make things right and move forward in a positive way. So that's great. That's amazing. So long COVID and chronic illness don't just affect your body. They take a toll on your mental health too. How did you navigate that emotional weight aspect?
So I think it links into what I said for my first answer, where there was a lot of denial at
Sure.
first. And I'd say I spent the first year of having long COVID doing things like playing video games or crafting or basically keeping myself busy so that I didn't have to think about it. Because the second I did start to think about it, I would just fall apart. And I'd say it was only this year where the emotions really did finally catch up to me. And I finally admitted that I was struggling with my mental health because the signs were all there. It's just, again, it was complete denial that it was happening. It's been in this past year where I finally have gone on to antidepressants. I've had therapy and I was diagnosed with severe depression, severe anxiety, post traumatic stress disorder, which again, I think the thing is the signs are all there. It's just you don't have a name for them. I would panic all the time if, something happened around me that reminded me of the experience, but I didn't know that it was PTSD until I got the diagnosis. So the biggest advice that I can give in that sense is, you do need to get help, and it's so much easier said than done. But it's really important to acknowledge the emotions that you're feeling because there are people out there who are equipped to help you and can help you process it. And mentally now, I'm probably doing the best I have done in 3 years because I finally accepted that something needed to change.
That's amazing. I think that's so important. You definitely have to have good mental health to support your physical health. So that's amazing. One of the things you're known for is creating accessible content, sharing mobility hacks, tips for brain fog, and just being real about life with chronic illness. Why is that so important to you? I think that's amazing. It's like, I want to kind of deep dive a little bit more into that.
I think for me, the big thing was when I was first diagnosed with long COVID and when I first noticed the symptoms of it, it felt like I was so alone and so isolated because there weren't that many people talking about it, or if they were, their symptoms didn't really align to what I was dealing with. And I just felt like I was the only person in the whole world that was going through these emotions, feeling these things, and having to change my life overnight. So for me, it's so important that other people can see someone who's going through the same thing as them and can help. And our stories might not be exactly the same, they never are, but it's something that I can provide an educational background of from lived experience. And if I only help one person through this entire journey, if I only get one single message that says your account has helped me, that's all worth it. I'm not creating content for fame or for money or anything like that. It is purely to educate people and to make sure that people feel supported in a way that I didn't.
That is amazing, Anita. I wish there would be more people out there like you because that's amazing. You're making a
Thank
true
you.
difference in people's lives. And you've had to reshape your identity from academic to advocate. How did you find purpose amid that uncertainty?
It was really, really difficult because, as I said earlier, my plan was to become a lecturer. And right from
Mhm.
being a young child, I was always that kid that was gifted, when it came to academics. I was always the gifted child. I was always the
That's wonderful.
and but the thing is, I think my identity became so tied up in that. And then once I mean, I'd done my bachelor's degree, I'd done my master's degree, I was just about to start my doctorate, and my plan was to be a
Mhm.
lecturer at the end of it. And then all of a sudden, my brain didn't work anymore, or at least certainly not in the way that it used to. And all of a sudden, it became this full identity crisis of who am I? Who am I without this academic, standpoint? Where do I go from here? And it took a really long time for me to figure out what else I wanted to do, because I was very much that person where there is no plan B. This was plan A, and this is what I was going to do. And that was it. And it became this huge question mark until, again, I realized that I was feeling so alone. And it became then my purpose to help other people. And it's not just necessarily through my social media that I want to help. So at the moment,
Mhm.
I'm doing a charity walk to raise money for a charity called Long COVID Kids, which helps educate parents if their children have long COVID. I'm also a volunteer for a company called Cards for Bravery. They donate like cards and presents to children who are in hospital. And that for now has been my purpose. And I didn't realize just how fulfilling it would feel being able to know that I've helped somebody else. And now, to be honest, I can't imagine, ever stepping back from this. This is such a fulfilling and amazing path that I've taken. And I'm just enjoying every single step of it.
That's wonderful. That's great. You're very talented, and it seems like you're, kind of helping in so many different ways, not just in one specific area. So that's wonderful. It's great. That's how you have chosen to use your time and your resources and your expertise. So that is great, and I definitely commend you for that. If someone listening is just beginning their chronic illness journey, well, based on your experience, what would you want them to know?
The first thing that I think I want to tell them is that they're not alone. I know that it might feel that way, and I completely understand why it feels that way, but they're really not. They are not alone. There are so many of us out there hiding away in various corners of the internet that they can find. Um, and the biggest thing that I can say is do try and look online for advice, because I think it's one of those things where, you can take medical advice, and of course you should. It's absolutely important that you listen to your doctors, to medical professionals, but it's a very different thing getting someone who has lived experience, because they will be able to consider avenues that, other people won't have even thought of, or that you wouldn't even consider to be a thing, because they live it every
Sure.
single day. And so my biggest thing I would say is try and reach out. You don't necessarily have to talk to us in the chronic illness community. If you just want to lurk online and learn a few tips and basically try and figure out how we live our day-to-day lives, because the amount of changes that I have made based on seeing somebody else post online and I go, wow, that's a really good idea. I should do that. And it makes my life so much easier, but I would never have thought of it by myself. It's only through watching others and seeing what they do that I've gone, that is an amazing idea. I should do that. So I'd really recommend that you search for your condition online, try and find content creators and learn from them, see what they do and learn from them.
That's amazing, and I 100% agree. I mean, there's so much power and knowledge and communicating and collaborating with people. So that's great advice. I'm sure our listeners would love to know more about you and are curious and how they can kind of continue to follow you and perhaps connect with you. Where can people find more information about you and the work that you're doing?
Well, thank you very much. So my account name is Chronically Anita, and at the moment, my main form of communication with everybody is through Instagram. So just search for Chronically Anita on Instagram, and literally every single thing I post will be on there. If you don't have Instagram, I'm also on Facebook and TikTok under the same username. There might be a slightly less amount of content on those places, but I can assure you I do still update them, and you'll still be able to contact me, message me, ask me any questions that you'd like to.
That's wonderful. That is great. And Anita, I just want to say again, thank you so much for your vulnerability, your strength, and your advocacy. So you're not just educating us, you're empowering us. And I encourage everyone to follow Anita's content and connect with her incredible community online. We'll include her links in the show notes for this. And I really hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. Thank you so much. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.